A short time ago, I spoke with East Bay doctor Runjhun Misra via Skype. I asked her about the new guidelines on wearing masks in public and whether California has seen a real difference since the shelter-at-home mandates. The CDC is now recommending that everyone start wearing a mask when they go outside. What are your thoughts on that? Are we there? Is this necessary?
The reason that CDC is now recommending that everyone wear a cloth mask, so something that you can make at home or maybe a bandana, is because we have a lot of people, 25% of people who are actually passing on this virus, they're completely asymptomatic. And we have new studies now that show this virus can actually be passed from breathing, yawning, talking. So you can just imagine if you're in the vicinity of someone and doing that and they don't even know that they're carrying the virus and inadvertently spreading, that's now what we're trying to control.
Based on the hospitalizations here in the Bay Area, where are we on this outbreak? Have you seen a real difference in the social distancing?
I'm really proud to be in California right now, more so than ever, because I think we were pioneers when it came to placing shelter-at-home policies, not only for Northern California first, but then a few days later for the entire state of California. And I think I agree, and I'm on the same page as all the other experts in saying that I'm cautiously optimistic that the measures we put in place, the shelter-at-home and social distancing, are actually working. Because if they weren't, we would have already been where New York is, unfortunately. But we are supposed to peak around April 27th. That still gives us about 2.5 weeks to get our resources in check.
Speaking of the doctors and nurses on the front lines, we've heard some harrowing stories coming out of Chicago, New York, New Orleans, places where they're really seeing a heavy surge right now. What are you hearing from the front lines here?
We're just waiting for right now. We do have cases. Every hospital has some cases, but we're not maxing out our ICUs. We're not maxing out our ventilators. Those are good things. If we can stagger how many people come into the hospitals needing these things, that's what we're trying to achieve. Then our shelter at home, then our social distancing has worked.
There's been a couple videos on the internet circulating about how folks sort of handle all the groceries and make sure everything's disinfected. What are your thoughts on that?
The best way that this virus is transmitted is between humans. We don't have any data right now that shows this virus is actively being transmitted from inanimate objects. However, it does stay alive on there. So we're just trying to take any precautions that we can take. I don't think we're ever going to be faulted to be overly aggressive. And I'll tell you myself that I'm one of those people. I get my disinfectant wipes out and I clean everything off. I wash the grocery bags. And now that Safeway is telling us that they're going to give, bag our groceries and not to bring our bags in because they're not going to be touching the bags, I'm gonna use their bags. I'm going to try to minimize any kind of transmission of the infection.
The number of Californians in the ICU for coronavirus has jumped since the beginning of the week. There are now 901 patients in intensive care compared to just under 600 on Monday. But hospitalizations have gone down from about 1,400 Monday to 1,200 today.